Hello, my name is Emma Bauman. I am a clinical social worker for the Pediatric Epilepsy Program at Mass General. I am speaking today about the process of accessing mental health services. Mental illnesses are among the most common health conditions in the United States. Currently, 1 in 5 children ages 13 to 18 have or will have a serious mental illness. Similarly, 1 in 5 adults live with a mental illness, and 50% of all lifetime cases of mental illness begin by age 14, and 75% begin by age 24. Furthermore, because of the COVID-19 pandemic, several surveys have shown a substantial increase in self-reported behavioral health symptoms. People are experiencing an increase in stress, anxiety, fear, sadness, and loneliness. And mental health disorders such as anxiety and depression have worsened. Specifically thinking about sunflower syndrome, we often hear patients report experiencing anxiety and depression for a multitude of reasons. For more information, I recommend listening to Lee Horn-Mebel's talk. Ultimately, if someone is struggling with their mental health, it can be beneficial to speak to a mental health provider. However, the process of finding a mental health provider can be overwhelming. I'm hoping that this presentation will help you in navigating the system and find a good fit. Mental health professionals are sometimes called counselors, therapists, mental health providers, social workers, psychologists, and it can be confusing. It can be beneficial to know the differences between these providers to help guide your process. So psychiatrists are doctors who specialize in the diagnosis and treatment of mental or psychiatric illnesses. They are licensed to prescribe medications. Similarly, nurse practitioners are also able to provide similar treatment. Psychologists have received a doctoral degree focused on psychology. They study the human mind and human behavior and are trained in counseling, psychotherapy, and psychological testing, which can help uncover emotional problems you may not realize are occurring. Psychologists are not able to prescribe medications like psychiatrists and nurse practitioners are. Social workers, such as myself, have obtained a master's degree and can also obtain a doctoral degree. Our goal is to enhance and maintain a person's psychological and social functioning. We provide empathy and counseling on interpersonal problems. Social workers help people function at their best in their environment and help people deal with relationships and social, personal, and family problems. We can also be referred as licensed clinical social workers. Mental health counselors have also obtained a master's degree and are licensed to independently diagnose and treat mental and emotional disorders. They can also be referred to as licensed mental health counselor or licensed marriage and family therapist. As you start this process, it can be important to narrow down what you're looking for. Some questions that can be helpful include, are you looking for someone to talk to for yourself, your child, your family, for a couple? Do you want to use insurance or do you want to pay out of pocket for services? What's your schedule and availability? Do you have any specific time constraints, such as only being able to meet during the weeknights or on weekends? What's the furthest you'd be willing to travel to for appointments? And what setting would you prefer to see them in? During the pandemic, services have become more widely available virtually. If you'd prefer to see someone in person, make sure the location's a place that you'd feel comfortable. Therapists can work out of places like their home, school, private practice, or a medical setting. It'd be helpful to think about if you'd prefer to talk to a male or a female. And lastly, would you prefer to be able to talk to them in another language? Is race, culture, spiritual beliefs important to your process? Now that you have an understanding of the types of mental health professionals and narrowed down what you're looking for, the next step would be to find referrals. The first step that I always recommend is calling your insurance. So there should be a customer service number or a specific behavioral health number on the back of your card. In order for your insurance to pay for therapy, you may need to pick from their list of approved providers. When they give you a list of providers, they may also be able to tell you which therapists have experience with your specific concerns. Next, I recommend talking to your primary care physician. Your PCP may know of therapists in your area and ones in your insurance network. They can also help to facilitate referrals. Another option can be to ask people you trust for a recommendation. So someone you know may be seeing a mental health provider themselves or know of someone. An additional option would be researching if your place of employment has something called an employee assistance program as part of their benefits package. Usually they would offer short-term counseling sessions, typically with no charge to you. If you want to continue therapy after that short-term period, they can help refer you to a therapist in the community who will take your insurance. The best way to find out if this is an option is to contact your employer or the human resource department. Lastly, there are several good websites where you can input what you're looking for, and they will help you find a match. The last step is to start calling providers and to schedule the first appointment. It can be helpful to brainstorm questions you may want to ask during that phone call, as well as questions they may ask of you. Some examples of questions that could be helpful for you to ask include if they're taking new clients, if they take your insurance, or if you're deciding to pay out of pocket, what their rate is, what is the cancellation policy, and what is their training and licensure. They may ask for you to explain your reasoning for seeking therapy, what specifically you are looking for. And as you're speaking to them, listen to your intuition. Do you feel supported? Do you feel comfortable speaking honestly with them? Ultimately, making the decision to go to therapy is incredibly courageous. Therefore, it's important to choose a therapist who is a good fit for you. You can expect your therapist to be someone who listens to you, is respectful and supportive, gives you appropriate feedback, and works with you to define the therapy needs and goals that you have for yourself. Remember, you may need to meet with more than one therapist before you find what works best for you. Take your time and be sure that your therapist is a good match. I've included some resources that you can use to search online and options for therapy matching to help with this process. Thank you all for listening. A special thank you to Gina O'Brien for helping with this presentation. Thank you.